Hello, hi, good morning everyone. Today question on normal labor. Question number 646. Which statement is true regarding normal delivery? Option A. Fetus is born at term. Option B. Fetus present vertex. Option C. Onset is spontaneous. And option D. All of above. These all are the statements that true regarding normal delivery. Option D is right answer. You can see the criteria of a normal labor or delivery: a spontaneous onset at term with cephalic presentation and a presentation of the head of the fetus in any position without prolongation, natural termination with a minimum help, and without any complication to mother and the fetus. These all are the characteristics of a normal labor. Question number 647. The sign of true labor is: option A. Mucous plug is expelled from cervix. Option B. A spontaneous rupture of membranes occur. Option C. Uterine contractions are regular and effective. And option D. Fetus drops into brim of pelvis. Uterine contractions are regular and effective. This is the sign of the true labor. Option C is right answer. Question number 648. True labor is characterized by: option A. Effacement and dilation of cervix. Option B. Painful uterine contraction. Option C. Suprapubic discomfort at regular interval. And option D. All of above. These all are the characteristics of a true labor. Option D is right answer. Question number 649. When teaching a 36 weeks prima gravida sign of true labor, the nurse would be sure to include: option A. When she feels pain in abdomen. Option B. When her pain radiates from lower back to abdomen. Option C. When there is a loss of a mucous plug. And option D. When she experiences lightning. Travel sign of impending labor is so. The right answer is option C. When there is loss of mucous plug, the sign of the true labor. Which is a primary sign of labor? Option A. Uterine contraction. Option B. Abdominal contraction. Option C. Pushing by mother. And option D. Intrathoracic pressure. Uterine contraction is a primary sign of labor. Option A is right answer. Question number 651. The characteristic feature of true labor is: option A. Contraction not getting stronger. Option B. Pain felt in front of the abdomen. Option C. Contraction continue irrespective of a posture. And option D. Irregular contraction. Contractions continue irrespective of posture. Option C is right answer. Question number 653. All of the following are feature of true labor except: option A. Shortened cervix. Option B. Uterine contraction always present. Option C. No show of labor symptoms. And option D. OS progressively dilated. Right answer is option C. No show of labor symptoms. Question number 654. False labor manifestations are as follow except: option A. Abdominal discomfort. Option B. Contractions irregular. Option C. Contraction lessens with activity or risk. Option D. Cervix progressively effaced and dilated. cervix progressively effaced and dilated यो ट्रू लेभलमा हुन्छ फल्स लेभलमा एब्डोमिनल डिस्कम्फोर्ट कन्ट्राक्सन इरेगुलर कन्ट्राक्सन रेजोनेन्स एक्टिभिटी और रेस्ट हुन्छ सो राइट आन्सर ऑप्शन डी क्वेश्चन नंबर 655 how does a nurse identify true labor as opposed to false labor option a contraction stop when client walks around option b contraction occur immediately after the membrane rupture option c cervix dilation is progressive and option d contraction progress only in a sideline position cervix dilation is progressive option c is right answer बाँकी अप्सनमा दिएको छ ए बी एन्ड डी त्यो फल्स लेभरमा हुन्छ क्वेसन नम्बर 656 ब्ल्याकस्टोन हिक्स कन्ट्राक्सन आर ऑप्शन ए painless uterine contraction during pregnancy option b painful uterine contractions of pregnancy option c painful uterine contraction of puberty and option d uterine contraction during fourth stage of labor irregular, infrequent, spasmodic, and painless uterine contraction without effacement and dilation of cervix from very early week of a pregnancy called Braxton-Hicks contraction or Hicks sign. Ultimately, it merges with true pain labor uterine contraction at a term. Painless uterine contraction during pregnancy. Option A is right answer. Question number 657. Infrequent, regular, and painless contractions felt on abdominal palpation during pregnancy are termed as option A. Braxton Hicks contraction, option B. Quickening, option C. None of above, and option D. Oscinder sign. Infrequent, irregular, and painless contraction are Braxton Hicks contraction. Option A is right answer. Question number 658. Braxton Hicks contraction start appearing at around option A 16 weeks, option B 24 weeks, option C 8 weeks, and option D 4 weeks. 8 to 10 weeks मा Braxton Hicks contraction start हुन्छ 8 to 10 weeks. Right answer option C 8 weeks. Question number 659. Client who is 32 weeks pregnant has just been admitted to the labor room in the first stage of labor. Which of the following clinical manifestation is considered abnormal and should be reported to physician immediately? Option A. Expulsions of a blood-tinged mucus plug. Option B. Continuous contractions of 2 minutes duration. Option C. Feeling of a pressure on a perineum causing her to bear down. Option D. Expulsions of a clear fluid from the vagina. At the beginning of first stage, contraction occurred at every 15 to 20 minutes for up to 30 seconds. And the end of first stage contraction occurred at 2 to 3 minutes interval at last for 50 to 60 seconds. Not continuous contractions of 2 minutes duration. Option B is right answer. Continuous contractions of 2 minutes duration. First stage मा चाहिँ हुन्छ. Question number 660. A client is admitted to the birthing suite in early active labor. Nursing action takes priority during the admission process. Option A. Obtaining the obstetrical history. Option B. Ascertaining whether the membranes have ruptured. Option C. Auscultating the fetal heart. Option D. Determining when the last meal was taken. The active labor first fetal heart rate size option C is right answer. Question number 661. The factor responsible for the dilation of cervix is option A, formation of bag of waters, option B, painful uterine contraction, option C, fetal axis pressure, and option D, all of above. The factors responsible for the dilation of cervix are painful uterine contractions and retraction, polarity of uterus, formation of water bag, fetal axis pressure. So the right answer is option D, all of above. Question number 662. During the first stage of labor, there is a swarm coordination between fundal contractions and cervical dilation called option A, polarity of uterus, option B, retraction ring, option C, lightening, and option D, none of above. The coordination between two pole of uterus, that is fundus and cervix. Top ma fundus र below ma cervix हुन्छ. During uterine contraction, in which upper pole, that is fundal, contract strongly to push the fetus, and lower pole, that is cervix, contract slightly to dilate. Fundal part contract हुन्छ किन पुश गर्नलाई फिटसलाई र लोअर पार्ट सर्भिक्सलाई स्लोली डाइलेट गर्नको लागि चाहिँ कन्ट्र्याक्ट हुन्छ. क्वेशनमा के सोधेको छ? There is a some coordination between the fundal contraction and cervical dilation called polarity of uterus. Option A is right answer. Question number 663. Coordination between fundal contraction and cervical dilation is called as option A, fundal dominance, option B, retraction, option C, effacement, and option D, polarity. This is polarity. Option D is right answer. Question number 664. The net effect of a retraction in normal labor are the following except option A, formation of lower uterine segment, option B, dilation and effacement of cervix, option C, increase the surface area of uterus, and option D, effective homeostasis after separation of placenta. Uterine retraction is a process by which the muscular fiber of uterine remain permanently shortened after each contraction. Option C is right answer. Increase the surface area of a uterus. Next question on other video. Thank you so much.